Hey community, this is Dr. Hugh coming at you, and today what I want to talk about is something that's, I would say, really outside of the box. I've had this on my mind probably for a couple of years. If you've been watching my station at all for a while, or have had any kind of looked at any of my content, I deal with a lot of people that are in pretty significant chronic health issues. I see a lot of people that have been hurt by antibiotics, specifically fluoroquinolones. I help lots of people with really severe, what I just say severe chronic illness. So I am willing to try a lot of different things to see if we can help move the needle, the healing needle. So today what I'm going to be talking about is peptides, and I'm going to be talking about injectable peptides. And I've had my attention on this for a while, and I've been a chiropractor for 26 years, and I've been doing functional medicine probably for 15. So over my career, I've adjusted a lot of people, and I have some what I would call chronic musculoskeletal problems myself. One in particular is my elbow, and my elbow is really sore actually because of pickleball, and it's been sore for about, I would say, 3 or 4 months. And then I've always had some low grade chronic low back pain issues that I've been dealing with. And I've done a lot of things. I've gotten adjusted regular. I take a bunch of vitamins. I take supplements. I exercise. So I wanted to try peptides and see, what I could actually get through peptides. So before I get into this, I just want to have this medical disclaimer: this is for information purposes only. You can get these things on the internet, and I've decided for myself that I was willing to try these peptides and see exactly, what kind of outcome what kind of things can I get? Can I get better? Can I get some musculoskeletal pain relief? So what I want to do right here is I want to go over the website. So right here, these are the peptides that I have bought, and this comes from basically, it's called Peptide Sciences in here. And this is my second round of peptides. Now, one of the peptides that I'm going to be going over right here is this one right in here, this is going to be a blend of BPC-157. So what exactly is BP-157? So if you read this little description right down in here. So BPC-157 is to basically improve blood flow and reduce inflammation. And then they also have this combination product, this second product here, which is called TB-500, which really stands for thymosin beta 4. And these peptides are really to try and decrease inflammation. And you can see here, heal muscles, tendons, and ligaments, and promoting new, basically, arterial flow to that area. So this is on the internet. You can get these on the internet, and you can see right here is all over the internet. It says here that this is not for human consumption. It's strictly for research purposes. Now, they're telling you that it's not for human use. It's not for veterinarian use, but yet they still have, hundreds and hundreds of, you can see all these different peptides, hundreds and hundreds of peptides that they are actually selling, right? They're actually selling these peptides to someone, and the only people that I can imagine that they're actually selling these peptides to are actually human beings that can use them themselves. So with everything, you have to weigh the pros and cons. Like, are you willing to try something like this, or you're not? So you got to look at the information. You got to evaluate everything and see your risk tolerance for doing BPC-157 injectables. There are some companies now that are coming out with oral, which I'm very excited about because that was an easier gradient, I think, for people. So I've done lots and lots of research on this, and I was finally comfortable doing this and trying to get some results. So one of the things that I did see here is if you just go on YouTube right here, and this right here, this one right here, the FDA suppressed this for years. This is by Dr. Josh Axe here. He has like 2.3. He has 2.3 million followers here. So this specifically, this one right here, this YouTube video that I watched was the determining factor for me to try to do the peptides, because one thing about Dr. Josh Axe is he actually did like a stem cell therapy I think about 3 years ago, and it got infected and he couldn't walk. Doctors said that he may never walk. It was a bad thing that happened. Somehow the needle got infected, and he had a major systemic infection, and his low back basically dissolved to nothing. And in this video right here, he talks about his success with his peptides and how the peptides contributed to his healing. And in here, he talks about a whole bunch of other different peptides that he recommends. Now, if you just go to YouTube here and just do BPC-157, let's just look at how much content there is on here. And there is lots of content on BPC-157. Here's this fella here. So he has 3.8 million subscribers. He's super ripped. He's super cut, and he's doing peptides. So I wanted to try it. I think this is my second round. The first round I strictly did BPC-157. Now the second round I'm doing the combination of products. So I kind of want to really share with you my experience, where I got them. So this is the exact blend that we're going to be going over right here. And then also there's a few things that you have to get. Now what I'm going to show you right here is these are the different products that you need to get. And I did lots and lots of research on this before I did this. I've been researching peptides probably for, I would say, 1 to 2 years, and I decided to go forward and move with it. So this comes from Peptide Science. This is what you're gonna get, and you're gonna get this little vial right in here. And you can see this is really small. This is this is the size of my finger in here, so you can see how small it is. So I'm going to open this up here so you can see, and I'm going to go through the whole process of what they call reconstituting this, because when you get these peptides, they come in a powder. Now I'm not sure if you can see that white stuff there. Okay, there's actually powder in there. Let me get a different angle right here. So if you can see, okay, so you can see that the powder right in there, right? So you can see the powder on the bottom there. Let me just flip it over, and you can see how the powder is gone right now, right? So what you're looking at right here is this is actually the peptide, and you can see here is this is a blend of, let me see if I can get closer. Yep, I can. BPC-157 and TB-500, and it basically 10 milligrams of each, right? So there's 10 milligrams of each in this little small bottle. And now here's Peptide Science. It's all over there. Not for human consumption. They also have a big warning label in here, but obviously people are using these things because well, they sell hundreds of different peptides, and someone's consuming these. All right, so in here, if you go to this right here, this is the needles that I've been using right here. You could just go on Amazon and buy those right here. That's exactly what I did. I watched a bunch of videos. This right here is what we call bacteriostatic water. So this has alcohol in it. You can see the alcohol right in there, right? So it's going to kill any bacteria that might possibly form. So this is the bacteriostatic water. You can see that it has the alcohol in there. And this is the syringe. This right here is obviously, that's a peptide in powder. And then we have the alcohol swabs. Now in here, this is the alcohol swabs that I have right in there. Now, one of the things that you have to do is you have to reconstitute it, because you have to make this a powder, right? And there's a whole process like this. So I'm going to walk you through this process right here, right now. Okay, so the first thing that we're going to do is we have the reconstituted water. And then this is just basically a simple insulin injectable needle. So I'm going to take this out of the package, and you can see what this looks like more closely right here. So you can see this needle right in here, and this is considered units right here. Let me flip this around. So this is considered units. So 100 units is 1 milliliter. Now, one of the things I did find is because you have to do some calculations when you reconstitute it. So what you have to do is you have to add this solution here to the peptides to make the peptides a liquid. Now, with all the research that I went over, I found this kind of cool calculator, which helps out quite a bit. So let me show you this right here. So this is the calculator. So it gives you the different syringes that you might buy. So I bought this one right here, right? This one right here, which is 100 units. And then it tells you how much peptide amounts in there. So it's 10 milligrams, right? But it's 10 milligrams and 10 milligrams. So there's 20 milligrams of total peptide in there, but each one is 10 milligrams. Okay, so this right here, just to give you the website right here, if you wanted to Google this right here, you could Google that and come up with the calculator. Now, if you do any research on this, so this is 10 milligrams. Now, one of the things that I want to do here is I want to have with how this comes out, I want to have a 250 microgram dose. Now again, this is where you have to do your own research on this, is on the internet. I'm just going by the internet. I'm not a medical doctor. I'm not your doctor. Is generally people dose this 250 micrograms to 500 micrograms. So a common dose would be 250 milligrams twice a day. Now I don't want to give myself 2 injections a day, so I've been doing anywhere from 250 to 500 micrograms per day. Now, what this does here is this is going to allow us to figure out how much peptide is in each injection, right? So we have to know that, right? And this comes down to the math, and this has been the best math that I've been able to find here. Okay, so this is what I'm decided to do. So I've got this needle right here, right? And if you just click it, it changes all these numbers down here. I have 10 milligrams of BPC-157, and I'm going to be putting in basically 4 milliliters of water. So what the heck is that? So 4 milliliters is going to be 4 of these syringes in right here, right? So each one right here is 100, that's 1 milliliter. Now, down here, this is going to give you the calculation. So if I want 250 milligrams of a dose, basically I'm going to be taking roughly 10, and it's really kind of small right here. 10, you can see the 10 right in here. So that's how big 250 micrograms would be. If I wanted to take 500 micrograms, so anywhere, I take anywhere from 250 to 500, then it would just be double that. It would be up to right in this area, right in here on that needle, okay? Now what I'm going to go through is I'm going to go through the reconstitution of this, and I'm going to be putting this solution in here, and we need 4 of these basically bacteriostatic water to go in here. Okay, so we're going to go ahead and reconstitute this. So here we have the bacteriostatic water. We have an alcohol swab. I'm going to just swab this tip right here. And then I'm going to do the same thing right in here. It has a little cap on it there. So that pops off. It's a little rubber there. You can see that little rubber hole right in there. We're going to take some alcohol swabs right there. Okay, so this is the needle right in there. I'm going to take this off here. And I'm going to take this off right in here. You can see that needle. Now, what I'm going to do here is I'm going to take this to 1 milliliter, right? You can see that right down. Now, we need 4 of these. I'm going to insert that. I'm going to push the air in there. And then I'm going to back this out. And you can see the water filling up there. You can feel pressure on there. Okay, take that out. And then this is the peptide. And then very gently here, what we want to do so very gently, what we want to do here is we are just going to insert that right into the center right here. And then you want to be very gentle. You can see how it's starting to push in here. There's pressure there. And you want to be very gentle with the peptide. You don't want to squirt it in there because the peptides are very, very gentle. And this is how we're going to start to what we call reconstitute it. Okay, now you can see here that is all liquid, but now we need to do 3 more of there. So I'm going to do 3 more, put 3 more in there. You can see it filling up. Okay. Going to take the peptide. And there's pressure in there, so it's going to start to automatically come down. So you don't want it to go too fast. Okay, so I'm going to put 2 more in there. I'm going to put the video on pause and put 2 more in there. Okay, so the bottle, so this is the first time I've done this here, the combination. So this bottle here can only hold 3 milliliters, this needle right here. So I put 3 in, and you can see how it's all the way up at the top here. So what I'm going to do here is I'm going to go back to my calculator right here and change this to 3. And then you can see here, if I wanted to do 250 micrograms, it's a little bit less than 10 on that dial right there, right? So if we look back at this here, is now you can see that that is crystal clear and it's all mixed up. Now, what the internet says is when you're done with this is you want to put this in the refrigerator after you're done injecting it. So what I'm going to do right now is I'm going to go over how I inject it myself, and you're going to see this firsthand. Okay, what I'm going to do right now is I'm going to do an injection. So I'm going to get a new needle right here. I'm going to open this up. I'm going to swab this right here. Now, what I want to do here is I'm going to actually do basically a 5 microgram dose. So I'm going to estimate that the needle here, we should be right around here for 500 micrograms. This isn't like an exact precision. Like if you're off by one or two of these little dials, I don't think it's really going to matter. So let's get back to this here. Okay, I'm going to take this off right here, and then the top off right here, right? And then you kind of bring the plunger down here a little bit, just so you can see where we're at. See if I can get that in focus. Okay, so you can see that's 20. So we're going to be right about there, okay? You see the center right there? We're going to try and get it right in that hole. And then you see how the needle got sucked in because there's pressure there. Now I'm going to slowly bring this out. And you can see how it's filling up right there. I'm not sure if you can see that. It's taking some time. Okay. So here we have it. And then I'm just going to push some of the air out until you see some come to the tip. You see it right there, right? All right, so we know that is filled up. Okay, so what you're looking at right here is my elbow. I'm just going to use a swab there, clean it. Now you could have someone pinch the skin, like, yeah, it just needs to go right underneath the skin. But again, that's what I learned on the internet. I'm not a medical doctor. I'm not your doctor. So this is the needle. You just put it in. Take it out. That's it. Okay, so that's the whole process from start to finish. What I think out there, I think there's lots and lots of therapies that help people out there that the government does not want you to know, because if you actually got your hands on some of these things, you'd actually get better and no one would make money. The reason why these peptides here, you can't patent a peptide. Like, these are peptides are naturally occurring substances that God put on planet Earth. So you cannot patent these things. So for there to be some study that says, oh, this peptide BPC is great, it helps this, there has to be billions of dollars put into that study, and no one's going to do that because no one's making money on these things. So at the end of the day, what I've learned after 26 years of clinical experience helping the most difficult cases is the most powerful tools are generally the most simple tools. Always start simple and then go from there. At the end of the day, if you found value in this, give me a thumbs up. If you're looking for some guided help, you can click the link somewhere in this video here and you can schedule a Zoom call. And with that being said, remember, is where there's help, there's hope. Take care. Bye-bye.